Good day, everyone. Thank you for joining us today as we reflect on the recent health intervention that we conducted involving Barangay Natividad, which is located in Guagua, Pampanga. But before we delve into the details, let's take a moment to consider the unique characteristics of our chosen barangay.
Situated in the heart of Pampanga, Barangay Natividad is a vibrant Kapampangan-speaking community, home to over 6,000 residents. But amidst the resilience lies a pressing issue, the health and well-being of our residents. By addressing the specific health needs of our community, we aim to improve the lives of every resident, from the youngest children to our most seasoned elders.
We are using catchy methods like jingles, interviews, infomercials, and brochures to educate people about managing diabetes and high blood pressure. So through interviews with healthcare experts and engaging jingles, we are making health information more accessible and memorable. Infomercials provide detailed advice and stories, while brochures offer quick references on symptoms and treatments. These methods help everyone understand and manage their health better. Our goal is to empower people in Barangay Natividad, Guagua, Pampanga, and beyond to prevent hypertension and lead healthier lives.
Now, as we move forward, let's explore the status of our health program implementation. The Kalma BP Kalma Hypertension Huwag Kang Mapressure program is actively educating the residents of Guagua Barangay Natividad on hypertension and diabetes. Key milestones include insightful interviews with healthcare and community figures like Nurse Ruby Kalma, Barangay Kagawad Ellen Cruz, and SK Kagawad Jaineri de la Cruz. Implementation tools including flyers, brochures, and infomercial were successfully shared on Facebook on May 29, 2024.
As of June 6, 2024, the program's infomercial has garnered 880 views, 29 likes, and 75 shares, indicating growing community awareness. Flyers and brochures have also received positive feedback with 23 likes, 2 comments, and 41 shares for the flyers, and 12 likes and 73 shares for the brochure. This reflects engagement. However, the transition from planned face-to-face seminars to online sessions due to adverse weather presented challenges in audience engagement and interaction.
Despite this hurdle, the program continues to progress. Our focus now is on enhancing participation in our Google Form survey to gather feedback and assess community knowledge. Additionally, efforts are underway to improve the reach of our educational materials and ensuring broader dissemination of information to the community.
Moving forward, let's now interpret the result of the pre-program survey and post-program survey. Among the total 101 respondents, the data shows a varied familiarity with hypertension or diabetes across different age groups. So older respondents tend to have a higher likelihood of knowing someone with these conditions compared to younger respondents. This suggests as people age, they may become more aware of or personally affected by these health issues, highlighting the importance of health education and awareness programs across all age demographics.
A majority of respondents, 70.3%, agree or strongly disagree that they are familiar with hypertension and diabetes, indicating a solid understanding among most individuals. However, 16.8% remain neutral, suggesting a need for further education, and 12.9% disagree or strongly disagree, indicating a need for more information about hypertension and diabetes. For the second question, over half of the respondents, 58.4%, feel they possess adequate knowledge about the connection between hypertension and diabetes, with 26.7% strongly agreeing and 31.7% agreeing. However, 28.7% remain neutral, suggesting room for enhanced education, and 10.9% disagree or strongly disagree. This indicates a relatively low level of familiarity. Next, regarding type 1 and type 2 diabetes, 47.5% of respondents agree or strongly agree that they have adequate knowledge about them. However, 31.7% are neutral, suggesting superficial or incomplete knowledge. Lastly, 20.8% disagree or strongly disagree, indicating a notable lack of understanding among some. For the fourth question, while a majority, 55.4%, feel well informed about hypertension medication, 28.7% remain neutral, suggesting limited knowledge, and 15.9% disagree or strongly disagree, indicating a gap in awareness among a notable minority. Next, there is a strong consensus with 75.2% either agreeing or strongly agreeing that lifestyle choices contribute to the development of hypertension and diabetes. Only a small minority, 6.9%, disagree, highlighting widespread recognition of this connection.
A notable majority, 83.1%, agree or strongly agree with the preventive power of a healthy diet against hypertension and diabetes. However, 10.9% are neutral, indicating potential lack of awareness, and 5.9% disagree, suggesting rare rejection of this notion. The majority, 76.3%, agree or strongly agree that regular physical activity helps prevent hypertension and diabetes. However, 17.8% are neutral, potentially indicating uncertainty, and only a minimal proportion, 5.9%, disagree. Perception regarding support for barangay and rural health units is mixed, with 62.3% agreeing or strongly agreeing that support is provided. However, 29.7% are neutral, and 7.9% disagree or strongly disagree, suggesting differing opinions on the adequacy of support. There is a strong consensus with 71.3% either agreeing or strongly agreeing on the importance of community programs for disease education and prevention. However, 25.7% are neutral, indicating some uncertainty or lack of opinion on this matter. In summary, the data highlights a strong level of awareness and knowledge regarding hypertension and diabetes among respondents, emphasizing the importance of preventive measures such as healthy lifestyle choices and community education programs, while also suggesting areas for further education to enhance understanding, particularly regarding the nonsense of diabetes and its connection to other chronic conditions.
Moving forward to the evaluation of the health program, we have number 1, clarity of information. The respondents highly rated the clarity of information presented in the jingle and infomercial about hypertension and diabetes. While a small percentage of 2% remained neutral, 12.9% agreed that the information was clear, and a significant majority of 85.1% strongly agreed, indicating exceptional clarity and effectiveness in educating viewers about these health conditions. Number 2, understanding symptoms and causes. Most respondents found that the jingle and infomercial helped them better understand the symptoms of hypertension and diabetes, with only 4% expressing neutrality and 83% strongly agreeing that the media were very helpful. It's evident that the jingle and infomercial effectively taught about these health issues. Number 3, ease of understanding and memorability. The majority of students, 84%, strongly agreed that the information in the jingle and infomercial was easy to understand and memorable, with only 1% neutral. This suggests effective communication that resonated with viewers and conveyed information clearly and memorably. Number 4, design reception. The responses indicate that the design of the jingle and infomercial was generally well received, with the majority of 79.2% strongly agreeing that it was eye-catching and not cluttered, with only 1% disagreeing. The design effectively captured viewers' attentions. Number 5, originality and message conveyance. Viewers generally found the design of the jingle and infomercial to be original and effective in conveying the messages about preventing and raising awareness about hypertension and diabetes, with 83% strongly agreeing and only 1% disagreeing. The design was perceived as innovative and impactful. Number 6, fitting design. The majority of the respondents, 85.1%, strongly supported the view that the design of the jingle and infomercial was fitting and of high quality for discussing hypertension and diabetes, with only a small proportion expressing neutrality. Number 7, impact on perception. An overwhelming majority of 84.2% strongly agreed that the jingle and infomercial influenced their perception of hypertension and diabetes, indicating that significant impact on viewers' understanding and awareness of these health issues.
8. Impact on viewers' life. Most viewers, 85.1%, strongly agreed that the jingle and infomercial had an impact on their lives and found the message easy to share with others, suggesting broad reach and potential for dissemination. 9. Effect on decision making. The majority, 84.2%, I think, strongly agreed that the information in the jingle and infomercial help them make decisions to avoid developing hypertension and diabetes, indicating perceived value and usefulness of the content for decision making. 10. Highlighting local options. A significant majority, 84.2%, strongly agreed that the jingle and infomercial highlighted local options for preventing hypertension and diabetes, indicating effectiveness in promoting community resources and services. 11. Impact and persuasion. A large majority, 86.1%, strongly agreed that the message of the jingle and infomercial was impactful and convincing, with only 4% expressing neutrality, suggesting persuasive effectiveness in conveying health-related messages. 12. Understanding the relationship. The results showed that viewers strongly agreed, I think 83.2%, with the message that hypertension is a symptom of diabetes, indicating a high level of understanding and acceptance of the relationship between the two conditions. 13. Highlighting preventive measures. The data indicates that the jingle and infomercial strongly reminded viewers how to prevent or take measures to avoid developing diabetes and hypertension while still young, with an overwhelming majority, 87.1%, strongly agreeing with this message. 14. Awareness of causes. The data suggests that viewers are aware of the reasons why people develop diabetes and hypertension, with a large majority, 86.1%, strongly agreeing that the content was informative in explaining the causes of these conditions. Overall, these findings indicate the effectiveness of the jingle and infomercial in raising awareness, conveying information, and positively impacting viewers' understanding and perceptions of hypertension and diabetes.
Recommendations for future health program designers. Focus on face-to-face education and awareness. Prioritize face-to-face seminars over online campaigns to directly reach the community and foster stronger connections. Incentivize attendance to boost participation and encourage open discussions about health issues. Number 2, teach technology literacy. Allocate time to teach people of all ages how to navigate technology for reliable health information. Emphasize critical thinking and the importance of consulting healthcare professionals for accurate diagnosis and treatment. Number 3, engage with the community. Conduct comprehensive needs assessment involving both health authorities and residents to tailor programs effectively. Collaborate with barangay staff for structured implementation and gather feedback for continuous improvement. By implementing these recommendations, future health program designers can better educate and engage with the community to address prevalent health issues effectively.
Recommendations for policymakers. Number 1, enhance technological literacy. Support programs to improve residents' ability to access reliable health information online, reducing misinformation and empowering informed decision-making. Number 2, support comprehensive needs assessment. Fund and facilitate regular needs assessment involving health authorities and community members to identify and address evolving health challenges effectively. Number 3, foster community engagement. Promote strategies that enhance community involvement in health programs, fostering cultural sensitivity and acceptance.
Next is strengthen health infrastructure. Invest in well-equipped barangay health centers and staff training to improve access to essential healthcare services. And for number 5, address socioeconomic determinants. Focus on addressing underlying socioeconomic factors like access to nutritious food and economic opportunities to promote overall well-being and reduce chronic disease incidence. By implementing these recommendations, policymakers can create an enabling environment for effective health interventions and improve health outcomes in Barangay Natividad and similar communities.
In conclusion, our report highlights the effectiveness of our chosen health intervention program in raising awareness and improving knowledge about hypertension and diabetes among the residents of Barangay Natividad. Together, we can build healthier communities and improve the well-being of all residents. Thank you.